We've used warp here at Stellar Rehab in conjunction with some of our typical treatment techniques, which includes not only manual techniques, hands-on therapy, as well as the different modalities that we already have in use. Warp actually is a nice adjunct to have in our treatment practice because it's something that's portable, it's something that patients can take with them to use. It's something that's affordable for their healthcare cost, and their long-term prognosis is actually improved when they have the ability to use not only the warp but other treatment techniques that we use here too, long-term. It's more of a functional lifestyle change rather than just doing the therapy to get rid of symptoms for short-term. Typically what I've used it for is chronic pain is a very big one, and that can come from a variety of sources, whether it's arthritis, tissue injury, recovery from surgery, sports injuries, the weekend warrior who strains a muscle here or there. We've found also, though, that with fibromyalgia, that's a nice treatment option of patients who don't typically get relief from other treatment forms. We've used infrared light therapy for that. And again, it's something that should be used on a regular basis, so a small handheld unit would be a perfect option for those patients to use on their own too. But I also think that this is something that's definitely proven. It's cost effective. It is something that will make a difference and also increase the person's healing time and their return to their functional activity or sport activity or wherever the pain came from in the first place. So.
Good.
Light therapy is very appropriate. It's non-invasive. It causes no harm to the patient. Basically, you use it over the skin's surface, and it's something that you can see a result real quickly, rather than, okay, I'm going to use this with you, and then in 4 to 6 weeks you may notice an improvement. This is something that in a short period of time, a short period of treatment, the person will get the results from the therapy itself. So I think it's probably more, for us, it's something that we would look at a real broad base of patients that we could use it with, and also the cost of the units themselves. I think that if you look in regards to medical equipment, the warp unit is actually very cost effective. And if you look at the amount of treatments that you can provide with this one particular unit on a variety of different patients, it was very effective in our practice to use it. There are research studies that show scientifically how light works, the light therapy works. What I see from patients is that I see a reduction in pain, I see an improvement in movement, an improvement in strength and in balance coordination, but most of all, they return to their functional everyday activities. So that means that if someone comes in here and they've injured their shoulder playing softball, they can return to those specific sports as well as their everyday activities by use of the therapy world and in particular light therapy. That when a person walks through the front door, they're not necessarily looking at, okay, I want to have a 5 out of 5 muscle strength, or I want to have 180 degrees motion in my shoulder. What I want to do is be able to return to my everyday functional activities. And this is certainly a nice option. Light therapy is a nice option in order to be able to get these people back into their everyday lives. I have a patient who had a rotator cuff injury and repair, surgical repair. And I was doing some scar modification, mobilization of the scar tissue. We actually used the warp light therapy right over that particular area before we did the scar mobilization. And the first time that I went to see the patient, I didn't have the warp unit with me. And the patient actually it's uncomfortable to do scar modification, scar mobilization, that you're breaking down scar tissue, so it's a little uncomfortable. So the first time she was kind of trying to get away from me a little bit. Second time I took the warp unit, used that first over the whole area and as well as the rotator cuff that was repaired. And I noticed much more comfort with the patient as well as more mobility of the tissue itself. So we had a real significant improvement from what I saw as a therapist as well as what the patient felt during the treatment. So that was a very nice option to have the warp unit with that. Another example is a person who had had a meniscal repair and came from basically a few weeks after having the surgery itself. With that particular patient, the main complaint was edema and pain in the joint. And along with doing manual techniques, the use of the light therapy was very appropriate to provide relief of the edema in that one pocket of the joint capsule itself. So that was a very nice, specific, localized way that this person could use the light therapy. Actually took it home a couple of times and used it under instruction, and I think the healing time was actually decreased significantly with him too. Along the same lines, pain medicine was used less with that particular patient, and any anti-inflammatory medications were also decreased along with the treatment that he had here too. Actually, what I would suggest is the person should actually use it in their treatment sessions. And I think probably one of the comments that I receive is, how can this be so helpful? How can this work so well? And until you actually try it in your practice and try it with patients, real life patients that have difficulties and have these issues like pain and swelling and decreased mobility, unless you see it in action on a person, you're not going to believe it yourself, because it actually is that good. It works so well. We do use it on a variety of patients. Almost on a daily basis, we're using some form of our light therapy with patients. So I would say to that professional, you would certainly need to try this. This is the background, this is how it works, this is what I've seen from other patients, but use it on yourself, use it on other patients, and see what difference it can make. My introduction into the use of light therapy with our outpatient business has been very smooth, a very smooth transition. I think that the company who produces the product has done an excellent job and is very responsive. I think that it is nice to say that as a Wisconsin business, we can refer to other Wisconsin businesses and show a product that is very effective. And the company is very forthcoming in any questions, any information. If there's any difficulty with the product, we certainly have seen a nice relationship with that company. I think that's very important.